Woman of my land, of the word African woman. Woman of my land, of the word African woman. What the such Africa is, what the sword that fed you.
Hi, I'm Norma M. Toomey, and this is my story regarding community engaged research. More recently, I've been thinking about medical care in South Los Angeles from a historical perspective. I grew up in Los Angeles in a poor neighborhood. From childhood to early adulthood, I received some basic primary care at a local doctor's office. However, when we didn't have insurance and cash was low, it was off to the old county hospital where a basic visit could take an entire day. I remember traveling a long distance to see a doctor, especially for specialty care. We would take 3 buses to get to the hospital and the clinic until a county facility was built in our more immediate community when I was 22 years old. I remember smaller local hospitals where my siblings were born and some county clinics, but they didn't provide the care we needed. Only recently did it dawn on me that many black doctors lacked the admitting privileges in major hospitals. Consequently, after providing prenatal care and other care in their offices, they sent their patients to hospitals where they were allowed to practice. I have been interested in the body and numbers for as long as I can remember and preferred math and life science in school. I love physical education and running street races with the neighborhood kids. I decided that I wanted to teach math and physical education when I grew up. Consequently, I began Cal State University at Los Angeles with a physical education major and a math minor. As time went on, I realized that it wasn't just the body I was interested in, it was overall health. Not much had changed since I was a little girl. I wanted to help make a change to ensure poor people could be well. In my sophomore year, I became involved with neighborhood social services and helped to start and direct a free clinic in South Los Angeles. My interest grew to include a more holistic approach to health care, and I returned to graduate school to study more about health and mental health. During my career, I helped to establish and serve in leadership for 2 other community medical and behavioral health clinics in Los Angeles and Berkeley, California. 8 years ago, I became involved with Charles Drew University and the University of California at Los Angeles Medical School's research endeavors around community engagement. I was invited to work with the schools and their students to help them develop best practices to engage with their patients in the community. I work with basic science researchers who are hard at work looking for causes, developing treatments, and hopefully finding cures for many illnesses and diseases that plague our poor and under-resourced communities, like those in South Los Angeles. Here, research is being conducted with and not on communities. As an individual with a diverse background, I participated as a full partner on non-traditional research teams in what is called community engaged research. I serve as a community representative on advisory boards that oversee the overall projects. I have conducted interviews, facilitated focus groups, and participated in planning events to disseminate research results back to the community. Unfortunately, things still haven't changed much since I was a child regarding poor health outcomes in my community. Poor people still have the highest rates of disease, disability, and preventable deaths. For instance, the decrease in smoking cessation rates across the nation still are not translated to lower rates of tobacco use in African American communities. My work over the last 8 years has culminated in my latest project, where I will be working with a research team to implement smoking cessation services in Los Angeles County mental health and health services clinics. I no longer consider research as something mysterious, but as something that warrants my attention and involvement. I work now to help with educational and health systems change to reverse these trends to ensure a longer and better quality of life for those in my community. Health science research studies are important because they help us to better understand illness and disease and what preventions, interventions, and treatments might work best for various populations. Most community engaged research is paid for with your tax dollars, so why not join me? Learn more. Get involved.